the most commonly prescribed medicines. They're used to treat bacterial infections. However, if a virus is making you sick, they could do more harm than good. Here's Dr. Sauer with today's St. Vincent Corner Clinic report.
What's important is not to take antibiotics unless you absolutely have to take antibiotics. These are very powerful drugs and they can do amazing things. However, we're losing the war against bacteria because we've used so many antibiotics for so many different reasons that the bacteria are becoming resistant.
What are the side effects of antibiotics?
Whenever we take antibiotics, it'll kill the bad bacteria, but it can also kill the good bacteria, which can allow yeast to overtake, and so that's how yeast infections happen. We can actually get a process where a bacterium called Clostridium difficile, or C. diff, can develop, and it actually stays in the colon, but when bacteria is killed off, the normal bacteria is killed off, it can rise up and take over. And when you get a large population of this, it can actually cause inflammation on the colon lining and cause a lot of major illness.
A lot of people these days take them before dental procedures. Is this necessary?
It's actually kind of become the standard of care, and a lot of people take antibiotics before dental procedures. However, there's not a lot of cases where that's typically warranted. I think it's more of a legal protection mechanism than it is based on good science. Frequently when people come to a physician's office, they're not going to feel like they've had a successful visit unless they have a piece of paper in their hand and a pill to take afterwards. However, most of the common infections that we give antibiotics for really aren't caused by bacteria. They're caused by viruses, and antibiotics do not kill viruses. They never have, and they never will.
It's always a good idea to discuss with your doctor if you've recently taken a dose of antibiotics. And remember, a prescription in hand is not necessarily the best medicine. For today's St. Vincent Corner Clinic report, I'm Jancy Sheets.